people. I think, as Sergeant Donahue mentioned, last year in 2006, there were 53 incidents that were water-related that occurred in the metro area here in Phoenix that involved very small children. 36 of those incidents occurred at swimming pools, and of the 53 kids involved, 8 did not make it. I think this certainly supports why it is so important that parents, that grandparents, and other child care providers learn and practice these life-saving choking rescue skills along with CPR on a very regular basis. Recognizing the critical importance of this need of skill sets, the Phoenix Heartball Committee created Have a Heart for Babies program with the initial goal of working with Valley hospitals to provide the infant CPR kits to new mothers and parents and all the individuals that come in contact with those infants. I have to tell you, as one of the hospitals involved in this and one of the healthcare systems, we truly do understand the need of what Captain Donahue was talking about, and that's really the aspect of prevention. We don't want to see people coming to the hospital after these untoward events. So today is really a very, very important day. It's the official unveiling of the Have a Heart for Babies program, and as Captain Donahue said, Phoenix is the first city in the U.S. to actually implement this program. I also want to, again, thank the Phoenix Fire Department for supporting us and the Have a Heart for Baby program, but I also want to congratulate the Heartball Committee for the work that they're doing in this community and their ongoing commitment to Have a Heart for Babies program so that every new parent can have the peace of mind of knowing that they are prepared to save their infants' lives should that need ever arise, and we hope it never does. One of the individuals who was one of the initial collaborators on this program was Bob Meyer, the president and CEO of Phoenix Children's Hospital. Unfortunately, Bob could not be here today, but he does have a number of representatives. I would like to introduce Dr. David Bank, the medical director of the emergency department at Phoenix Children's Hospital.
Thank you, Susan. It's nerve-wracking to stand in a place where CEOs are supposed to stand or stand, but I appreciate the opportunity to represent Phoenix Children's Hospital today. Phoenix Children's Hospital would like to thank all of the community outreach that's been done through the Heartball to support this effort, because I truly believe that this is a significant program that is going to make a difference both locally and nationally. It is a thrill to be here at Station 61 as well. They threw this up pretty quickly. I didn't even notice that we were here. But there are tremendous advocates for children in the Phoenix Fire Department, many of whom I see frequently. Dan, John Gallagher, Bobby Kahn. Tremendous amount of work and passion for the well-being of infants and children in this state. Kudos to the American Academy of Pediatrics and the American Heart Association for putting this together. One of the drawbacks that we've seen in terms of dealing with that initial choking event or breathing event in infants and children is the nervousness and the time that people need to take to set aside to do these programs. I think it's been shown very well through research that the videotape adjuncts to education when it comes to basic life support work well. And I think that the goal of the American Heart Association to enroll 20 million babysitters, grandparents, child care providers per year between now and 2010 is reachable based on the fact that this is a very well done video and really has all of the components that are necessary to save a child's life.